Good afternoon, everyone, and thanks for tuning into this month's ZOHU call. We'll begin the webinar shortly. Please stand by. Good afternoon, everyone. My name is Ria Guy, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health office, I'm really pleased to welcome you to the monthly Zoonoses and One Health Updates call today, December 6, 2023. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. So please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is also being recorded. If you have any objections, you can disconnect now. Links to the resources from each of the excellent presentations that we have today are going to be available on our website at cdc.gov/onehealth/zohu/2023/december.html. Next slide, please. So today's presentations are going to address one or more of the following 5 objectives. Identify an implication for human, animal, and environmental health. Identify a One Health approach strategy for prevention of public health threats. Identify a One Health approach strategy for detection of public health threats. Identify a One Health approach strategy for responding to public health threats, or list 2 ways to improve collaborative practice across the public healthcare team. Next slide, please. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products or products under investigational use. CDC, our planners, presenters, and their spouses or partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there's no bias. The presentations will not include any discussion of the unlabeled use of a product or product under investigational use. And CDC did not accept commercial support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/onehealth/zohu/continuing education. And the course access code is ZOHU webcast. To receive free CE for today's webcast, you can complete the evaluation at cdc.gov/TCE online by January 8th, 2023. A captioned video for today's webinar will be posted on cdc.gov/onehealth/2023/december.html within 30 days. And free CE for the web on demand video of today's webinar is going to be available until January 9th, 2026. Next slide, please. So before we get into today's presentations, we've got Dr. Colin Basler, who's the Deputy Director of CDC's One Health office on the line, and he's going to share some news and updates. So Colin, over to you.
Thanks, Ria. Good afternoon, everyone, and thanks again for joining us for the December ZOHU call. We invite you to share the ZOHU call website link with your colleagues from the public health, agriculture, wildlife, plant, and environmental health fields so we can let them know about the live webinars, video recordings, and free continuing education that the ZOHU call offers. Before our presentations start, I'll take a few moments to share some updates and resources. As always, you can find the links to these resources in today's ZOHU Call email newsletter. And of course, if you aren't yet subscribed to the newsletter, please sign up using the link at the top of the main ZOHU Call webpage so you can get this monthly update from us. In today's newsletter, we highlight several recent publications, including a multi-city study of indoor air quality in green versus non-green low-income housing, and foodborne illness source attribution estimates for Salmonella, E. coli 0157, and Listeria monocytogenes in the United States. Next slide, please. We've also included publications on human salmonellosis outbreaks linked to Salmonella typhimurium epidemic in wild songbirds in the United States, and a publication titled Risk Factors for Health Impairments in Children After Hospitalization for Acute COVID-19 or MISC, and that stands for Multi-System Inflammatory Syndrome in Children. We also have a publication on restaurant and staff characteristics related to practices that could contribute to cross-contamination. Next slide. Here we've highlighted some announcements and resources, including a webpage that shares recent CDC respiratory virus updates, a spotlight on CDC and partners' work to update suggested measures to minimize influenza spread at swine exhibitions, and an EPA, USDA, and FDA request for public comment on the draft national strategy that aims to reduce food loss and waste in the United States. Next slide, please. Additional resource highlights include a CDC health advisory on high blood levels in children consuming recalled cinnamon applesauce pouches, and an article discussing how tools from the Centers for Disease Control and Prevention can help prevent and control Legionella growth and spread. Next slide, please. December events and observances that may be of interest include World Soil Day, which occurred on Tuesday, December 5th. And today at 7 p.m. Eastern Standard Time, USDA's Animal and Plant Health Inspection Service will host a webinar titled Antimicrobial Resistance, the Role of Attending Veterinarians at Animal Facilities. Next slide, please. Finally, we've shared updates on several ongoing outbreak investigations, including separate salmonella outbreaks that are linked to cantaloupes, salmonella outbreak linked to dried dog food, and one linked to fresh diced onions, a listeria outbreak linked to peaches, nectarines, and plums, as well as some additional outbreak investigations listed here. Next slide, please. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases and find details about ongoing U.S. outbreaks on the CDC website linked from today's newsletter. Our next ZOHU call will take place on February 7th, 2024. Please continue to send presenter and topic suggestions for future presentations, as well as news from your organizations to zohucall@cdc.gov. That's zohucall@cdc.gov. And with that, I will turn the call back over to Ria. Thanks.
Thanks so much, Colin. Next slide, please. So you may submit questions at any time using Zoom's Q&A feature. When you do submit questions, please include the topic or the presenter's name so we know who to identify. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. You can see their emails are displayed on this slide. You can also go to the ZOHU Call webpage for today's webinar and in today's email newsletter. Next slide, please. So let's get into it. Today's first presentation is Knowledge, Attitudes, and Practices of Veterinary Professionals in Ohio regarding ticks and tick-borne diseases. And we have Dr. Andreas Eleftheriou on the line. So Andreas, please begin when you're ready.
Great, thank you so much. And thank you so much for giving me the opportunity to speak today about this project. So this particular project was recently published in the journal One Health, and the link to what I'll be talking to you today is available on the ZOHU website. So today my goal here is to give you a brief overview of this particular project that we completed in Ohio. Next slide, please. I'm sure that many of you are aware that ticks and tick-borne associated diseases are increasing across space and time. Specifically, when we think about North America, there are a lot of ticks of veterinary medical veterinary medical significance are becoming more problematic. Tick bites in general can lead to anemia, infectious disease transmission, and in certain cases, allergic conditions. And specifically in Ohio, there's been a rise in the number of ticks that have a medical and veterinary significance. So on the right of the screen, I'm showing just the primary tick species that we're concerned with in Ohio. And you can see that in red, I'm showing where the particular range of that tick is currently. So, and the arrows point to different directions of the expansion. So you can see that we have the Lone Star tick or the black-legged tick or the Asian longhorn tick that are expanding the ranges within Ohio and therefore are becoming more problematic for humans and animals. Next slide, please. Now, veterinary professionals are at a much higher risk of exposure to ticks and associated diseases because of two primary reasons. So the first one is that they directly work with animals. And the second is that they visit tick habitats for providing on-site care, such as cattle and pasture, for example. As a result, veterinary professionals are experiencing novel occupational exposures, but also novel clinical presentations in their animal populations. What's important to realize about veterinary professionals is that they're critical for bridging the gap between animal and human health through client education. Next slide, please. So as I've talked to you about that, we're experiencing expansions of different ticks within Ohio. We wanted to inform education interventions regarding this topic for our veterinary professionals within the state. So when I'm using the term veterinary professionals, I'm referring to veterinarians, but also non-veterinarians. And I'll touch upon this later on when I get into the details of the survey. So in order for us to inform education interventions, we wanted to first assess the knowledge, attitudes, and practices towards ticks and tick-borne diseases of this population and identify preferred delivery methods for continuing education regarding this topic. Next slide, please. So we ended up designing a survey that included 43 questions with a predicted completion time of 10 to 20 minutes. And this particular survey consisted of 5 different sections that have different themes. Essentially, there were tick exposure, knowledge about tick biology, identification, tick-borne diseases. The third one was demographic and practice information, followed by attitudes and control and prevention practices. Now, some of the questions were conditional on the answers from previous questions, so not all questions were shown to the participants. The actual questionnaire was electronic and it was self-administered in English. It was available through an online survey platform, namely Qualtrics, and we made it be mobile-friendly and anonymous. It went through 2 development stages. The first one was by a research team. So the survey went through internal content validation, and then through an external validation by 1 small and 3 large animal veterinarians. Before we distributed the questionnaire to participants, we incorporated all of that feedback. Next slide, please. In order to have a participant take the survey, they had to meet 3 eligibility criteria. So these were be a veterinary professional, so they needed to be a veterinarian or a registered veterinary technician or veterinary assistant. So the last 2 are what we term non-veterinarian. They also needed to reside in Ohio, and they needed to be over 18 years of age. We did provide a financial incentive, so if they completed the survey, they were eligible for a $5 gift card. We recruited participants through a number of mechanisms. The first one was through blanket advertising on social media platforms, through individualized emails to small, large, and mixed animal practices, through employing our widespread extension network that we have at The Ohio State University, where we have extension employees in all 88 counties of Ohio. And then lastly, we recruited our participants through 2 large animal commodity groups within Ohio. The survey itself was available from September 2021 to July 2022, but we actively recruited participants from the start of the survey until January 2022, and then we just left it open. Next slide, please. Now we're ready to just go into how we dealt with the data that we received. So originally we got 1,632 entries, but as we went through the data and using Qualtrics fraud detection mechanisms, we actually identified that most of those, 1,428, were fraudulent or duplicate responses. And this is something that we noticed happened when we were blanket advertising on social media. So a lot of robots were able to find the survey and take it from social media. But after we were able to exclude all those fraudulent responses, we ended up with 244 entries that we went through and realized that there were about 26 surveys that were less than 80% completed. So once we excluded those, we ended up with 178 entries. So much smaller sample size than we were hoping for in the beginning, but still modestly a modest size. And today I'll be describing frequencies and percentages from those entries regarding the different sections that we looked at through the survey. There's more in the paper that's available on the ZOHU website if you wanted more details. Next slide, please. All right, so now we're ready to go through some of the data. So for each of the slides to come, I'll be sharing with you the key takeaways from the different sections. So we found that most of our participants, about 67% of them, described themselves as men, and about 51% of them described themselves as veterinarians. So a good portion of them were not veterinarians. More than 50% of them described their practice as mixed animal or small animal. Next slide. Now, this is some knowledge key takeaways for this particular survey. So what I'm showing here are a couple of graphs that show the distribution of responses to 2 questions. So the top one is showing responses to the question, do you feel confident with identification of this tick? And the bottom one shows the distribution of the responses to the question, do you believe this tick is in Ohio? And what we can see here is that there's a lot of different tick species, and you can see the legend for the acronyms that I'm showing there on the bottom left. But what I want to share with you here is that Dermacentor variabilis, or the American dog tick, is really the tick that most participants felt confident with identifying, and most of them also believed that this tick was in Ohio. Now, the one that the participants felt less confident that they were able to identify or they believed was in Ohio was the Asian longwood tick, and this is actually our newest invader in Ohio. So essentially, we're able to identify some deficiencies here in their knowledge of tick identification. Next slide, please. Moving on into the knowledge section a little bit more, we found that most of our participants rated themselves as a beginner or average in terms of their abilities to identify ticks. And about 40% of them felt somewhat comfortable identifying the different life stages of ticks, including larva, nymph, and adult. We did have a couple of questions in the survey that directly assessed their knowledge, and these are the ones I'm going to share with you next. So we asked them which of the following life stages require a blood meal, and they could choose more than one answer, and the options we had were nymph, adult, and larva. And as we can see, 63.5% of our participants thought that nymph required a blood meal, but less of them thought that adult and larvae required a blood meal. Of course, the correct answer is that all 3 of them require a blood meal, but we can see that that wasn't necessarily what we're seeing. The next question that is sort of in the same space was, how do ticks find their hosts? Again, they could choose more than one answer, and we had about 61% of them choose choose the answer, climb up plants and wait for hosts to walk by, which is the correct answer. But we can also see that about 42% of them selected that ticks can find their hosts by dropping from trees, which we know to be incorrect. Next slide, please. When we asked them about their exposures to ticks, we found that about 66% of our veterinary professionals encounter ticks most frequently at work. And we also asked them a few questions about their exposure frequency, whether they were in the farm or whether they were in the hospital setting. And what we can see is that more than 50% of them selected that the finding ticks on themselves either rarely happened or happened every few months or infrequently. Next slide, please. Moving to the attitudes section, we found that our population showed similar opinion for whether ticks pose major or minor health risks to themselves and their coworkers. And they also shared similar opinion for whether ticks pose major or minor health risks to clients. About 57% of our professionals in large or mixed animal practice thought that ticks or tick-borne diseases severely affected the productivity or performance of their patient populations. Next slide, please. And then finishing up with the practices section, we identified that our veterinary professionals used more than one preventive strategy. So in fact, we found that more than 50% of them were using tick repellents, and also they were checking themselves for ticks soon after leaving the area. So they were practicing more than one type of prevention strategy. We also found that about 71% of veterinary professionals routinely check their patients for ticks, and also about the same percentage, most of our professionals had submitted a tick to a lab for identification during their careers. Next slide, please. Now, out of those who never had submitted a tick for identification, the main reasons were listed as lack of awareness and associated costs. The topic most professionals were interested in learning about was local tick-borne disease risks. And most of our population reported learning about ticks and associated diseases through veterinary school and continuing education. Now, the most preferred format for learning new content were selected as written literature and tick identification charts. Next slide, please. I'm just going to finish off this presentation with some take-home messages because I share with you a lot of descriptive statistics. In general, we found that our veterinary professionals lacked in certain aspects of knowledge, particularly in basic tick biology and identification and local occurrence of ticks and tick-borne diseases. Regardless of this lack in knowledge, they actually exhibited cautionary attitudes, and they perceived ticks for the most part as hazards to human and animal health. We did also find that exposure occurs most frequently at work, which seems to be in contrast with the more the general population, where they come more frequently in contact with ticks when they're recreationally, when they engage in recreational practices. And lastly, we found that veterinary professionals show strong practices through routine tick checks and by using 2 or more prevention practices. And lastly, we identified that the 2 main barriers to tick submission for surveillance purposes are awareness and costs. Next slide, please. And I want to finish off with the next steps that we're taking at the Ohio State University by sort of thinking about informing our development of educational brochures based on the survey results. So what I'm showing here is just a couple of examples of brochures that we are putting together to address and fill in the knowledge gaps that we identified. So information on biology, tick identification, and occurrence within Ohio. We are hoping to remove barriers for surveillance by alerting our population that they can submit ticks to Ohio State University. And also, we would like to promote assets, so encourage good practices in our population that they're already doing. Next slide, please. And with that, thank you so much for your attention. I'll be happy to take any questions if you have any, and if we have time at the end of this presentation. Thank you.
Thank you so much, Andreas. It really seems like your CAP study was an excellent way of determining gaps in practitioner knowledge. Again, if our audience has any questions for Andreas, please feel free to submit them via the Q&A, and we'll get to them at the end if there is time. Our next presentation, next slide, please, is Mycobacterium orygus outbreak in imported macaques. And for this, we have Samantha Swisher on the line. So Samantha, I'll pass to you, and please begin when you're ready.
Thank you, Ria. Next slide, please. So to set the scene, I want to start by showing you some historical data from CDC's tuberculosis surveillance of imported non-human primates from fiscal years 2010 to 2020. So the gray line and the axis on the right show the total number of non-human primate shipments per year, while the teal bars on the left axis show the number of shipments where at least one non-human primate tested positive on a tuberculin skin test. So just like in humans, tuberculin skin tests in non-human primates can yield false positives. So any animal that tests positive is required to undergo additional confirmatory testing. None of the animals that had positive skin tests during this period ended up having a positive culture. Now let's look at a graph that includes the most recent 3 years. Next slide, please. So as before, you can see the shipments that had positive skin tests in teal, but now you can also see orange bars, which represent non-human primate shipments in which at least one animal had culture-confirmed tuberculosis. The gray line tells us that this happened despite the fact that the total number of shipments was comparable to or lower than previous years. So the question then becomes, why is this happening? What changed in 2021? And that's what we're going to talk about today. Next slide, please. So we recognize that many of you may not have a lot of familiarity with non-human primate importation. So I'm going to start out with a brief overview of how and why non-human primate importation is regulated by CDC. We'll then move on to talk about recent changes that might explain the increasing number of TB cases in recent years. And then I'll close by describing an example of a shipment with positive animals so you can see how these outbreaks unfold. Next slide, please. And again. So multiple government agencies work together to oversee non-human primate importation. The CDC focuses on the public health implications of non-human primate importation, while USDA handles welfare concerns, and U.S. Fish and Wildlife Service is responsible for wildlife conservation issues. Our presentation today will focus on CDC's role. Next slide, please. CDC's regulatory authority over the importation of non-human primates comes from Title 42 of the Code of Federal Regulations. As you can see, the purpose of these regulations is to prevent the transmission of communicable disease from imported non-human primates or their offspring to humans. The regulation gives us authority to inspect importers' records, shipments, and facilities. Next slide, please. The regulations also specify that non-human primates can only be imported for approved purposes, which include research, education, and exhibition. Importing non-human primates for the pet trade or for private collections is strictly prohibited, and all importers are responsible for assuring that the animals that they import are only used for approved purposes. At this time, the vast majority of imported non-human primates are used for research. Next slide, please. CDC requirements for importers cover every step of the importation process, from the moment that the non-human primates land at a U.S. port of entry until they're released from quarantine. Importers are required to be registered with CDC and undergo periodic unannounced inspections, to implement strict biosecurity procedures, both during transport and at the quarantine facility, to have rigorous worker health and safety programs, and to comply with CDC required disease testing. We'll discuss each of these requirements in more detail over the next few slides. Next slide, please. So we'll start off with registration and inspection. All importers are required to register with CDC, and in order to be approved, they have to submit extensive written documentation of how their facility will comply with regulatory requirements, and they have to agree to periodic unannounced inspections of their shipments and facilities. This is a list of the numbers of importers currently registered with CDC by type. You can see that the majority are commercial importers who primarily import animals for use in research. Next slide, please. Registered importers are required to have biosecurity procedures in place to make sure that other cargo in the plane with a shipment isn't contaminated, and that the plane is suitably disinfected after the animals are unloaded. Once they get to quarantine facilities, the animals are housed in secure negative pressure quarantine rooms and are only cared for by personnel who have received appropriate training in biosecurity and the use of personal protective equipment. All disinfection protocols must include products that are effective against tuberculosis, and waste is disposed of as biohazardous material. Next slide, please. Importers are also responsible for protecting the health of everyone involved in the transport and quarantine of the non-human primates that they import. This includes assuring proper PPE training and respiratory fit testing, as well as having engineering controls like negative pressure ventilation. They also have to have plans in place to prevent and manage exposure events, and they have to notify CDC immediately if any caretakers develop febrile illness. Finally, animal workers in quarantine facilities are required to undergo TB testing at least annually, and the frequency is increased if tuberculosis is detected in any animals in the facility. Next slide, please. Because it can be difficult to verify the reliability of diagnostic tests that are conducted outside the US, CDC doesn't have any requirements for pre-arrival disease testing in non-human primates, though importers are free to require this from suppliers if they wish. Once the animals arrive in the US, they're taken straight to an approved quarantine facility that is operated by the importer. They must remain in quarantine until they've completed a series of 3 negative tuberculin skin tests administered at least 2 weeks apart. If any animals test positive, they are removed from the group, and the remainder of the cohort is required to undergo 5 additional TB tests that are all negative before being released from quarantine. If a non-human primate develops signs of illness while in quarantine, CDC veterinarians have the authority to require additional testing to determine the underlying cause. Any animals that die or are euthanized have to have a necropsy performed. Next slide, please. So now we'll review some recent trends in non-human primate importation. Next slide. This map shows the number. Can you go back 1 slide, please? Thank you. This map shows the number of non-human primates imported to the US by country of origin in fiscal year 2019. So you can see China was by far the leading source of imported non-human primates, with a little under 20,000 non-human primates coming from China. This represents about 56% of the non-human primates that were imported in 2019. Next slide, please. This map shows the data from fiscal year 2023. You may have already noticed some differences, but let's look at the data in a different way so we can see the magnitude of the changes. Next slide, please. This graph shows the number of non-human primates imported by country of origin in 2019, represented by the teal dots, and 2023 in orange. The most notable change is that Chinese exports, which previously represented over half of non-human primates imported to the US, completely stopped in 2020. We're not entirely sure why China stopped exporting non-human primates. It may have been linked to the COVID-19 pandemic, but so far China has not resumed exporting non-human primates, and we are unsure if they will in the future. The inability to obtain non-human primates from known suppliers in China has forced US importers to identify other sources, primarily in Mauritius and in Southeast Asia. Next slide, please. So now we'll discuss a real example of a tuberculosis outbreak in a shipment that came from Southeast Asia. Next slide. In January 2023, a shipment of 540 cynomolgus macaques was imported from Southeast Asia and transported to an approved quarantine facility. In accordance with regulations, the macaques were unloaded and transported by trained personnel wearing appropriate PPE, and transport vehicles were disinfected with a tuberculocidal disinfectant. I should mention that this slide shows a typical non-human primate shipment being offloaded from an aircraft, but this photo and the images on the following slides are not taken from this specific outbreak. Next slide, please. Once the non-human primates had been settled in the quarantine facility, the importer began the required series of 3 tuberculin skin tests. In early February, the importer's veterinarian notified CDC that a macaque in the shipment had a positive skin test. This animal was euthanized, and acid-fast bacteria were observed upon microscopic examination of a nodule in the lung. While these findings were strongly suggestive of tuberculosis, CDC requires a positive culture before a case can be considered confirmed. While we were waiting for confirmation, several other animals in the group had positive skin tests. Next slide, please. When the culture and whole genome sequencing results came back, they revealed Mycobacterium aureus, which is part of the Mycobacterium tuberculosis complex. M. aureus was first reported in South Africa, but most subsequent cases have been in South Asia or in individuals that had some prior connection to South Asia. It has been reported both in people and in animals, mostly ruminants, and it's still unclear what species is or are the primary reservoir. Many common diagnostic tests can't differentiate it from M. tuberculosis, so its true prevalence and distribution are unknown. The isolates from this outbreak were all closely related, which suggests that the animals were most likely infected from the same source in their country of origin. Next slide, please. Fortunately, the importer had already been following CDC's occupational health and safety requirements, and a risk assessment performed by CDC concluded that their staff's exposure risk was low. Nevertheless, staff with animal contact underwent post-exposure TB testing and all were negative. The importer also conducted PPE refresher training for all of their staff. Next slide, please. There ended up being a total of 26 confirmed cases of tuberculosis in macaques from this shipment, which represents 4.8% of the shipment and is the largest outbreak of tuberculosis in quarantined non-human primates in the US to date. The remaining macaques in this group were required to have at least 5 negative skin tests since the last positive animal was removed from their group before they could be released from quarantine. This resulted in animals being released in 3 batches between April and August of this year. Since tuberculosis is a very slowly progressive disease, it's impossible to guarantee that any animal is tuberculosis-free, even after prolonged quarantine and multiple negative skin tests. So CDC recommended that the importer notify the recipients of the macaques in this shipment about their history. While CDC does not regulate non-human primates after they leave quarantine, we have requested voluntary reporting if any macaques from this shipment test positive in the future. Next slide, please. So the data that I've shown you today illustrate how changing supply chains can alter zoonotic disease risk associated with imported animals and highlight the importance of continued vigilance in this area. It's important to note, though, that the system worked as intended here. Tuberculosis screening requirements allowed prompt detection of affected animals, and adherence to occupational health and safety recommendations has so far prevented any human cases associated with this outbreak. Next slide, please. Thank you for your attention today. I'm happy to answer any questions you may have during the question and answer session at the end if time permits.
Thank you so much, Samantha. That was such a great overview of CDC regulated importation and a really nice, succinct outbreak study. So now we're going to move into our final presentation, which is trends in veterinarian drug dispensations in Washington State. And this will be presented by Audrey Hu. So Audrey, please begin when you're ready.
Thank you. Well, good morning, good afternoon to everyone. My name is Audrey Hu, and I'm an epidemiologist with the Washington State Department of Health. And I just want to say thank you for this opportunity to speak with you all today. I work for our state's prescription monitoring program, which is a program housed under the Health Systems Quality Assurance Division. And I'll be sharing some epidemiological trends we've seen in our data on veterinarian drug dispensations in Washington State. Next slide, please. So I wanted to start with some background on the opioid epidemic in the United States to put into context how veterinarian drug dispensations can contribute to the overall opioid epidemic in the US. So the opioid epidemic can be characterized with 3 distinct waves. The first wave started in the 1990s with increased prescribing of opioids, leading to overdose deaths involving prescription opioids. Then around 2010, a second wave began with increases in overdose deaths involving heroin. And a third wave started a few years later with increases in overdose deaths involving synthetic opioids like illicitly manufactured fentanyl. And to date, more than 1 million people have died from a drug overdose in the United States, and many of these deaths are attributable to prescription opioid misuse. Next slide, please. Prescription drug monitoring programs, or PDMPs or PMPs, are state-level interventions that were created to improve opioid prescribing, inform clinical practice, prevent prescription drug misuse, and protect patients at risk. They consist of an electronic database that tracks controlled substance prescriptions in a state. So when pharmacists dispense controlled substances to patients, they have to enter the prescription into the state PDMP. Then healthcare providers can use this database to check patients' prescribing histories and inform their prescribing decisions. State health departments like Washington State use the PMP as a public health surveillance tool to understand the behavior of the epidemic and inform and evaluate interventions. Next slide, please. In Washington State, the PMP is used to make prescription drug information available to medical providers and pharmacists as a patient care tool. My team works to analyze and report on patterns in controlled substance prescribing in Washington State, and this helps programs that work on reducing drug overdose deaths to understand how prescriptions contribute to this issue, and also help patients and providers understand trends in medications and risks associated with prescribing. Most of the metrics we look at are focused on human prescriptions, but we also require veterinarians to report all controlled substance prescriptions for more than 2 weeks day supply. Controlled substances include Schedule 2 through 5 drugs, such as opioids, sedatives, benzodiazepines, and stimulants. And while most efforts to prevent drug misuse are focused on healthcare providers, veterinarians also routinely prescribe and administer controlled substances, such as opioids. So I'll be sharing a look at trends in veterinarian prescription drug dispensations in Washington from the past decade. Next slide, please. So here is an overview of the total number of veterinarian prescriptions dispensed for animals in Washington State. I think the most interesting thing to note was just the sheer volume of prescriptions that have been dispensed over the past 10 years. So around 1.26 million veterinarian prescriptions have been dispensed for animals. And of those, opioids comprise close to 60% of prescriptions, with sedatives comprising around 30% of the prescriptions and benzodiazepines making up about 12% of veterinarian prescriptions. Next slide. So here's a breakdown of the prescriptions by individual drug to see which drugs are contributing most to the overall counts. And I'm just showing the top 15 drugs that were prescribed, with the opioid tramadol being the top prescription drug and comprising about 487,000 prescriptions, or around 40% of all veterinarian prescriptions. And out of all of the veterinarian prescribed controlled substances, the top 5 of them, being tramadol, phenobarbital, hydrocodone, alprazolam, and buprenorphine, comprise 91% of veterinarian prescriptions in our database, really making up the majority of veterinarian prescriptions reported to the PMP. Next slide. Next, I looked at the number of veterinarian prescriptions filled over time. So in 2016, there was a peak in the number of prescriptions filled, and that has decreased in recent years, although the number of prescriptions hits more of a plateau from 2018 onwards. And this decrease in opioid prescriptions follows a similar trend to human opioid prescriptions, as prescriptions for opioids in general have decreased in the recent decade. And please note that this only includes half of the prescriptions from 2023, so that data is incomplete. Next slide, please. And since the top 5 drugs comprise more than 90% of all veterinarian prescriptions, I took a closer look at them individually, where you can see that tramadol and lavender started getting reported to the PMP after 2014. And seems to largely drive the increase in prescriptions in 2016 and 2017 that we saw previously. So prior to 2014, tramadol was still being prescribed, but it wasn't reported to the PNP because it wasn't classified as a controlled substance. And of these top 5 drugs, tramadol, hydrocodone in green, and buprenorphine in pink are all opioids. Phenobarbital in navy blue is a sedative, and alprazolam in magenta is a benzodiazepine. Next slide. Then taking a look at prescriptions by drug class shows that the proportion of drug type varies quite a bit per year. So for example, in our 2022 data, around 40% of prescriptions were for sedatives, 45% were for opioids, and about 13% were for benzodiazepines. And in recent years, we can see that the proportion of prescribed sedatives and benzodiazepines has increased overall, while opioids have decreased. But this is largely because the number of opioids prescribed has decreased overall. So while the amount of sedatives and benzodiazepine prescriptions have stayed about the same, they just make up more of that total proportion. And in particular, the drug class breakdown in the years 2012 to 2014 looks pretty different from the rest of the following years, and that is largely due to the introduction of tramadol being classified as a controlled substance. Next slide. Overall, there have been 6,272 veterinarians in Washington state that have prescribed at least one controlled substance per year between 2012 to 2023. And on average, in this time frame, 2,240 veterinarians have prescribed at least one controlled substance per year. Those veterinarians have prescribed around 1.26 million prescriptions for controlled substances in that time frame, the majority of prescriptions being for opioids, followed by sedatives and benzodiazepines. And as a point of reference, veterinary prescriptions comprise only about 1% of all prescriptions within the PNP database for Washington state. Next slide. So to get an overall understanding of how many controlled substances a veterinarian may be prescribing in general, I calculated an annual veterinarian prescribing rate by taking the total number of veterinarian prescriptions per year and dividing that by the total number of veterinarians that had prescribed a controlled substance in that year. And I found that the average prescribing rate was about 52 prescriptions of controlled substances per veterinarian. And that ranged between around 30 prescriptions per veterinarian in 2013 to 109 prescriptions per veterinarian in 2019. And please note that this metric only includes reported veterinarian prescriptions. So since the Washington PNP only requires veterinarians to report prescriptions of controlled substances for more than 14 days, this does not encompass all veterinarian prescriptions, as there are veterinarians who may not prescribe controlled substances or prescribe in larger days supply. Next slide, please. So one of the main limitations of this data is that animal patient records do not have a patient ID and are not systematically linked the way that human PNP records are. And so we really only knew the number and type of prescriptions, and we're not able to track patients over time. In addition, we don't know the type of animal, so it's hard to make comparisons between animals. And while we have data on drug dosage and day supply, it was hard to estimate reasonable drug dosages since animals vary so much in size, and large animals like horses probably receive different dosages compared to smaller animals like cats. Next slide, please. So nevertheless, this analysis showed that veterinarians in Washington state have prescribed and continue to prescribe substantial quantities of controlled substances. Most of the efforts to prevent opioid misuse is focused on healthcare providers and the pharmaceutical industry, but veterinarians frequently hold DEA licenses and routinely prescribe, administer, and dispense controlled substances. And while this is intended for the treatment of animals, there is also potential for diversion and abuse. A better understanding of veterinarian prescription data and integration with the PMP helped our team to acknowledge the magnitude and scope of our data related to veterinarians. And this can be used to assess trends in veterinarian prescribing practices and create opportunities for educational training for veterinarians. Next slide, please. I'd just like to acknowledge and thank my team at the Washington State Department of Health for their support in developing this analysis. And next slide. And I can take some time for questions now. Thanks for your time and attention and the opportunity to present on this. Thanks.
Thank you so much, Audrey, for your presentation. I think many of us might not think about how animal prescriptions are a One Health issue, but your presentation did a great job of highlighting why and how it is. And with that, I'd really like to thank all of today's speakers for their informative presentations. Next slide, please. So before we get to our question and answer period, just wanted to mention that links to resources from each presentation are available on our website at cdc.gov/onehealth/zohu/2023/december.html. And we do have time now for a few questions. So if you haven't already, please go ahead and use the Q&A feature in the Zoom to send your questions. And please do try and include either the presenter name or the subject so we can track who those questions should go to. So maybe to get started with, we'll start with our first presenter, Andreas, on the CAP study. So Andreas, we've got a couple questions here for you. The first is, what would be done differently in the future to avoid the huge portion of fraudulent responses? Lessons learned. Thank you.
Yes, thank you for the question. Definitely lessons learned. I think in the future, we'd have to be a little bit more careful about blanket advertising on social media, especially when there's a financial incentive involved. Because I do believe that that was a major mechanism by which robots were able to see the survey. Thank you.
Perfect. Thank you. And maybe we'll just ask you a couple more while we have you on the spot here. Have you reached out to other neighboring states to see if similar should be done in these states? And they mentioned Michigan.
Yes, again, thank you for the question. So I'm aware that a similar CAP study targeting veterinary professionals has been done in Illinois, which is obviously nearby. I'm not sure about Michigan. I do know that there are probably, I think in Alaska as well, they've done something similar, but potentially, I think that each state potentially should look at this as something that they could do for their veterinary professional population. But we may consider that as something that we would do in the future to reach out if needed to nearby states to let them know of what we've done. Thank you.
Perfect. Thank you. And maybe just one more question for you for now. Is it possible to receive the Ohio tick chart if you are a licensed Ohio vet but do not live in Ohio?
Oh, yes, of course. So we're developing this brochure specifically for ticks and tick-borne disease risks that are more focused in Ohio, but definitely this is something that we could share. We are anticipating sharing this through our extension network online, so it should be publicly available. If anybody who's interested in receiving these brochures can contact me at my OSU email address, and I can refer them to the website. Thank you.
Perfect. Thank you so much. Let's move on to some questions for our second presenter, Samantha. So Samantha, the first question we have for you is, why is culture positive the criteria that you are focusing on for TB?
That's a great question. So the reason that we currently use that as our official criteria to confirm TB is because that is what the regulations require. Some of our importers do perform other tests that are used in humans, like PCR or acid-fast testing, and we do take those results into account. But in terms of officially considering a case confirmed, the regulations say that we are supposed to use culture, and that might change in the future, but that's the way it is for now.
Perfect. Thank you. A couple more for you, Samantha, before we move on to our last presenter. Are there estimates or evidence of illegal importations?
So that depends on what you mean by illegal importations. Most of the animals that we see that are entering the country illegally are spider monkeys that are being smuggled in small quantities for the pet trade. And those animals, to my knowledge, have not been associated with any tuberculosis issues thus far. U.S. Fish and Wildlife has been investigating some issues with animals that were imported that didn't meet CITES requirements, but that's not under our jurisdiction, the issues of where animals are coming from. So from our perspective, the only ones that we collect data on are the ones that are smuggled in for the pet trade, and those animals have not been associated with tuberculosis.
Perfect. Thank you, Samantha. Maybe a couple more here. So do the importer employed DVMs perform that necropsy on animals that are dead on arrival or die during that CDC quarantine period, or are the CDC vets performing that necropsy?
So the necropsies are performed by veterinarians that are employed by the importer. I will say I've reviewed a lot of these necropsy reports and they are very thorough and they seem to do a very good job. So I don't have, concerns that there are quality issues associated with that.
Perfect. Thank you. And maybe one more before we switch to our last presenter. Is there any way to see if China is exporting non-human primates at all? As in, did they stop exporting non-human primates everywhere or just to the US in 2020? And were there any regulatory restrictions put in place around 2020 that might have led to that drop we saw in China non-human primate exports?
Yeah, so of course, we don't personally collect data on exports from China to other countries. It is our impression that exports have stopped completely, like exports to other countries are not happening as well, but because we aren't responsible for collecting data on that, I can't say that for sure. There were no regulations on the US side that would have led to a decrease in imports from China. However, China did publish a ban on exportation of wildlife. These animals are not technically wildlife, they're captive bred. So we're not sure if that is related to the decreases that we're seeing or if it's coming from something else.
Perfect. Thank you so much, Samantha. We'll get you off the hot seat for now. And maybe we can turn to Audrey, our last presenter. Audrey, it looks like there's some questions for you as well. So one of those was, did responses include what route the drug were prescribed for? I imagine something like fentanyl would only include something like a fentanyl patch, unless this includes hospitalized patients. I've never known of outpatients prescribing of hydromorphone, methadone, etc. So the route of administration of the prescription would be interesting to know.
Yes, thanks for this question. So we do actually have that information because we collect the information from the drug's NDC code. So that's like the national drug code, and it includes information about the ingredient, strength, dosage form, and route of administration. So that would be interesting to look at.
Perfect. And then really the question of the hour perhaps is, has there been any evidence of inappropriate prescribing of controlled substances by veterinarians?
I think that's a really great question to raise. I think there may not be very concrete evidence, but I think at least in I think the article I shared, there is just like, I think anecdotal evidence or things that veterinarians have noticed where they have maybe noticed that there could be abuse of prescriptions, but I mean there isn't some way, I think, for us to track this concretely. So it's a little hard to say, but I think like anecdotally or in like news articles, there's been some evidence, but overall, I think it's hard to say.
Yeah, that makes sense. Okay, well, we're just about at time. Unfortunately, we weren't able to get to all of the questions, and some of those were really excellent questions in the chat. So if you do have other questions for today's presenters that we weren't able to get to, we have included their email on the slide that you're seeing, and it's on the ZOHU call webpage for today's webinar and in today's email newsletter. In addition, a video of today's webinar will be posted in the next 30 days. So with that, we will wrap up the call for today. Again, wanted to give a thanks to all three of our amazing presenters for today. And we invite our audience to join us for the next ZOHU call on February 7th, 2024. Thank you for your participation. This ends today's webinar.